Good. So I'm going to turn your head this way. Wow. So we have Lewis here today. We're here in New York City. What do you want to work on today? Where are your achy spots?
Well, mostly it's actually my lower back.
Lower back, okay.
Like my ankles and
Ankles.
pretty much my feet, yeah.
All right. So maybe sit for a second and take your socks off because we're going to eventually need to have you take them off. So let's have them off now. And how long's the lower back been bothering you?
For a couple of days.
I'll put this on the shelf.
Okay.
Can put it right up here. A couple of days. Okay. So let's have you lie on your back first, okay? And you're gonna be face up here. And I'm just gonna hold your leg up like this. Keep it firm. Don't let me push it down. So keep it strong right here. Good. And then turn it out a little bit. Hold. Good. And drop it down. Hold this leg up. Hold. Strong. Good. And turn it out. Hold. That one's a little weak. Do you feel? Which side of your lower back is worse, the left or the right?
To the left.
Left, yeah. Hold this one more time. Hold. Do you see how it goes weak? Mm-hmm. So lie face down. And I'm going to give you a piece of paper for under your face, okay? There's a lot of paper, but let's just do one of them. And put your nose right in there. And this time, same thing. You're going to lift this leg up, lift it all the way in the air, and then put it back down. And then do this side and put it back down. So which one's harder to lift?
Same thing, left one.
Left one? Okay. Do you feel a spot that hurts when you lift your leg? Like maybe near where my thumb is?
Yeah, pretty much right here.
All right. Now lift your leg, your left leg. I'm on it, right? Is that it?
Yeah.
All right, good. Drop your leg. So I'm going to come in with my elbow a little bit and just work that out. Do you feel that nasty spot there?
Yeah.
All right. Right there. All right, now lift your left leg. Does it change at all? Does it hurt any less?
Less, yeah. I feel it.
Okay.
Yeah, left. A little better, actually.
What?
Better.
A little better, right?
Yeah.
All right, I'm just kind of learning, figuring out what to do next. Seeing how your body moves, see how your body responds. This is a very gentle instrument, but it gets in there. Try your left leg again. Less pain, a little better, right?
Well, yeah, better.
Do you see how much higher it came up?
Mm-hmm.
Good. Try it again. Compared to when we started, how much better is it doing?
Way better.
Way better, right? So look, I'm going to tap it a little bit with this, okay? Feel the weight of that. It's a pretty heavy thing. You feel it?
Yeah, it feels like a pound.
Yeah, it's a heavy. But I'm going to get right on that sacrum because the sacrum's a little high on this side. Now lift that left leg. Nice, right?
Mm-hmm.
Less pain. Is it less pain or?
Yeah. Less pain now.
Try it now. Good. So the next thing I'm going to do is lie on your back. Stay in the center of the table. Actually, you know what? Because you're pretty tall, I'm going to have you come down a lot. That's probably good right there. And then lie back down. And I'm going to just drop the table down to the lowest level. That's about as low as it goes. And I'm going to just do a kind of a distraction pull on your neck. Okay. But sometimes you'll feel it down the lower back. We'll see how deep it goes. You'll have to tell me. So let's get this around. You can help me. Pull it under your head, past your hair. Pull your hair through. And then tilt your head back just a little bit. Good. And let me get this thing to also... It wraps around the chin to keep your head in.
Okay.
Do you feel like it's catching on the back of your neck pretty good? Yeah, it is.
Mm-hmm.
Good. So I'm going to do this. And this. Does it feel okay? It should be tight.
Yeah. It doesn't bother.
Okay, good. So put your hands on your lap. Yeah, like down there. So I'm going to start to stretch, stretch, stretch. What did you notice? Did you hear pop?
Yeah.
And more in the neck, right?
Yep.
All right, so lay there. I'll be right back. And drop your head down. So now I'm going to do a little bit more, okay?
Mm-hmm.
Take a big breath in and relax. Did it pop at all when I did that?
Yeah.
A little bit, right?
Yeah.
Good. So I'm going to turn your head this way. Wow. Nice, right?
Mm-hmm.
Beautiful. Nice. Lie face down. I'm moving you around a bit, right?
Yeah.
Face down again. And drop the arms. Good. Good. Lie on your side facing me. How you doing so far?
Pretty good.
Pretty good. Bend the top knee up. Let me just grab this arm. You can relax the leg now. Nice. That's that left lower back.
Yeah.
You feel it pop?
Yeah.
Good. Come to the other side. Pull this top knee up. Good. Good. Lie on your back. You can keep the pillow if you want, okay?
All right.
And I'm going to come in and just see what the ankles are doing, okay? So let this relax. All right. Come stand. Move around a little, see how you feel. A little looser?
Yeah. Yeah, especially my back.
All right. That was the main focus, right?
Yeah, pretty much.
All right. Thanks, man.